Donna will be on shortly. She's just finishing up a meeting.
Okay, it looks like we have about 16 total participants, and then we have about 20 to 25 who signed up. So we'll just wait just a little bit till they all join in.
Sandy, I see a hand raised. Sandy Kellner, you want to go ahead and say something?
Thank you. I just wanted to test the raise hand feature to make sure that you guys could hear me. And after I raised the hand, and then now I was able to speak. So that's good. Thank you very much. That's
Thank
all
you.
I have.
Thank you. I think we are, oh, I apologize, my video's off. Hello, everyone. My name is Fran Musi. I'm Director of Paratransit for Milwaukee County Transit System. And I believe we're still waiting for Donna Brown Martin to join us from another meeting. But I thought maybe I could take care of some of the housekeeping things while we're waiting for Donna. So today you'll be hearing from Donna Brown Martin, who is the Director of Transportation at Milwaukee County DOT. Myself, and then Jeff Sponcia from Milwaukee County DOT will also be here assisting. What we are going to do is Donna has a couple of slides that she would like to share with the group with some information, and then she will answer questions or listen to statements from members of the audience. We do ask that we do have a tight time schedule. Our sign language interpreters do have another meeting immediately after this one. So we're asking that people, keep your comments brief and to the point. If you want to post additional questions or comments in the chat, we would be happy to get back to them. We do have someone who's monitoring the chat feature, so we can do that. As Donna is speaking, we will ask everyone to stay muted, and then when you would like to speak, also for I guess video integrity, we are recording this session today, and in order to make sure that we have good video feed, we'll ask that you keep your cameras off and your mics off until you are ready to speak. If you can use the raise hand feature, we would appreciate that. We'll try and I'll call on people in the order that you've raised your hands, but we do ask that you keep your cameras off and your computers muted unless you're speaking. The PowerPoint slides that Donna is sharing will also be available on the Transit Plus website a little later this week. We will be posting those. So we're really just waiting for Donna to join us and we can get started. So does anyone have any questions for me before we kick it off? I'm not seeing any hands. So maybe we'll just wait another moment for Donna, and then we'll go from there.
All right. Hello, everybody. My apologies for being late. Nothing like cabinet meetings that you weren't expecting. So have we done introductions already? Okay.
Yes, Donna, I did introduce myself in the panel. I set some ground rules about keeping muted and posting questions in chat. So we are ready for you.
Okay, wonderful. So good afternoon, everyone. My name is Donna Brown Martin. I'm the director of Milwaukee County Department of Transportation. And I have a couple of slides that I want to walk us through. I know the introductions have been done already. You've met Fran and you've met Jeff. This is the team that's pulling together these listening sessions and trying to make sure that we collect as many of the questions and address as many of the concerns as we can. But remember that this is going to be an ongoing process. So it doesn't end with these listening sessions and it doesn't end with the budgeting process. It's ongoing. So let's get started. Next slide. All right. The current contract with American United Taxi Cab Service, or AU, that runs through May 31st, 2023, does not include new federal requirements. And in addition to, just making sure that we have funding and so forth, these requirements are really important. First, I want to tell you that the Milwaukee County Board of Supervisors Finance Committee has approved the continuation of this contract through December 31st, 2023. But this still will require the entire county board's approval within the next 2 weeks as they complete the 2023 budget. So just keep that in the forefront of your mind. Second, FTA has clarified that same-day demand response programs, such as our taxi service, are required to have wheelchair accessible vehicles, or WAVEs, as they're called, available for clients who use mobility devices. And that's part of the federal code, 49 CFR, section 37.77. Lastly, in March 2022, the FTA Drug and Alcohol Regulation Updates newsletter clarified for all transit agencies the requirements for random drug and alcohol testing for contractors of recipients of urbanized area programs. Basically, our section 5307, which funds our overall transit system and our paratransit system. In short, this guidance explains that random drug and alcohol testing for drivers is required unless clients are allowed to choose between 2 or more taxi providers. FTA has implemented a series of new requirements, just what I outlined listed above. And the next contract will need to include and reflect these changes. So I'm going to give Fran just a minute here before we go to the next slide. In terms of the discussion with the FTA, Fran, on the waves and the alcohol regulations, can you just provide just a little bit more detail so it's clear for them what it is that we're needing to do in order to move forward with the paratransit or the Transit Plus taxi service?
Sure, Donna. The taxi program currently uses mostly sedan vehicles, which are not accessible for people who use power mobility devices. They're accessible for people who fold up. You have a walker or a manual wheelchair that can be folded and stowed in the trunk, but they are not accessible for riders who use power chairs. And the requirement is that we have to have wheelchair accessible vehicles available on that program. And those types of vehicles do not exist in American United's metered taxi fleet as it exists today. The drug and alcohol regulations are something that, again, random drug and alcohol testing is something that our van drivers have always had to do. But with the taxi program, we were under the understanding that the option between paratransit and taxi would qualify us for what was commonly known as the taxi exemption, which would allow the taxi drivers not to have to undergo random testing. But that clarification came out in May of this year, and again earlier in October, just last month. They reiterated that the taxi exemption only applies in situations where riders have the choice between 2 taxi companies for a taxi program. And we obviously do not have 2 taxi companies under contract to provide the service right now.
Thank you. Thank you. So if we could go to the second slide, please. So the cost per trip on a remodeled same-day ride program that has the wheelchair accessible vehicles and random drug testing would exceed the cost per trip on the existing taxi program. Currently, riders pay $4 per trip. Milwaukee and MCTS pays the rest of the fare between $4.01 and $14.60. The rider must pay the rest if the trip costs more than that $14.61 price tag or more. The current average cost for a total ride is about $12.68. Under a revamped same-day ride program with the new federal requirements, the WAVE program, wheelchair accessible vehicles, and the drug and alcohol testing, we estimate that costs to be conservatively in the range of between $35 and $45 per trip in all. If ridership on this program remained at 2021 levels, this program would be estimated to cost a minimum of $737,980 for between 20,000 to 25,000 rides. Milwaukee County, which just, I don't have the actual dollar amount, but that would mean that the cost per ride would go up for you. So it wouldn't be $4 and it wouldn't be on average $12.68 per ride. We anticipate that those costs would double at a minimum. Milwaukee County is looking to collaborate with its Department of Health and Human Services partners, especially the state of Wisconsin, to identify revamped, sustainable service and funding options to meet the needs of the constituents impacted. Transit Plus taxi service is a discretionary program, and existing paratransit vans have plenty of capacity for the ambulatory riders who move off the taxi service. That's true. But as we said, and given what the county board has outlined, we are looking for options and we're exploring what we might be able to do to keep this service moving forward. And so your help in terms of helping us to come up with ideas, working with us to work with not only the administration from the Evers administration, but also with our legislators to ensure that we are looking at all the options that potentially could be available to us. So I want to open it up now for any questions and concerns, statements that people want to make. Please, I know that Fran has mentioned this, but we want to be respectful of our ASL interpreters' time, both Derek and Jill. Thank you so much for your help on this. And we will get started with people raising questions.
Donna, I do see a hand from a participant by the name of Ronald Jenkins.
Okay.
Ronald, you want to go ahead and unmute and go ahead and speak, please?
Yes, hi. My name is Ronald Jenkins, and I've been with the Transit Plus program for about 8-9 months. For the most part, the service has been pretty good. But I understand with these changes that instead of it being $4, we're saying like it may be anywhere between 12 and 36 or something like that for using the taxi service.
I'm sorry, could you just repeat that? You kind of, the sound went out for me for just a second. You said 12, were you quoting the dollar amount?
We're saying, yeah, so let's say we keep this program in place, you said it would probably more likely double.
We think
So
it
like
will double or
$12 or something?
triple. We believe it'll double or triple the cost of what it is now, because the vans they have to have vans for everyone. We also have to cover the costs of drug testing for those drivers randomly throughout the process.
So the individual, so I'm saying like me, like I use a walker right now. So
Yes.
I would need to pay, okay, so it affects us, everybody.
Yes,
It would.
it
Okay.
does.
So then what are the options that are kind of in place then? I mean, I'm saying like $4 is, oh, go ahead.
So in terms of options, that's what I between now and May is what we have to explore. I need to, as I stated, I need to meet with the state of Wisconsin to see if we might be able to possibly increase the amount of funding that we have for the paratransit taxi plus service, as well as paratransit service. I mean, it's been flat for quite some time. Increases in that funding have not been, we haven't had significant increases over the last 3-4 years. Other areas in which we might need to take a look at is partnerships between ourselves and the persons with disabilities, a group that also provides rides for people, as well as DHSS and their program for riding. We need to brainstorm and develop these new ideas, because I can't continue with the service as it stands right now.
But you do realize that this taxi service is convenient. Like I said, I know we have the cab, I mean the van and the bus, but the bus isn't safe. And number two, I shouldn't have to call in 24 hours in advance just to go to Walmart, to just go to the restaurant.
That I understand you, and that's why we're having these sessions to hear your concerns. And as I said, over the course of the next several months, we will be working to identify options to bring back to this group and the community about what it is that we can do. And where you guys will be very helpful in working with us on this is just contacting your legislators to ensure that we are able to bring funding to bear for this effort.
I'm I'm gonna be very PG about this because it's just like I guess people. I'm not saying with you obviously, but I'm saying like people are disabled. So for whatever reason, they're disabled, wherever the health concern. I guess it's a big deal to me because I'm currently disabled, and having this service, like you just said, you're having options, but I don't know. I just can't get my thoughts out right. I'm just disappointed.
Let me make myself clear. Right, my marching orders are to take the service that you have now and try to give you options so that you can keep the service. But how that's done really depends on what we can get in terms of assistance, how we might be able to brainstorm to make this work, and what things that we might need to tweak or change. I'm not saying that the service will be identical to what you have right now, but it will be an on-demand service that we're looking for, okay? That's the best I can give you right now without having, delved into the details and the other issues.
All right, so we sound good for now. So I mean, like you said, this is an ongoing process. It isn't like this is taking effect tomorrow, but yeah, this needs to be, especially with wintertime coming up. And I did see that you said a possibility is to extend until the end of December of next year.
End of December of 2023, yes.
Okay.
And it looks like, sorry to interrupt, we do have another hand up for.
I'm done.
Yep. For our
Thank
child
you.
Mason. Yep. Thank you so much, Ronald. I do want to remind folks, we're giving you all 2 minutes to make your statement so we can give everyone the opportunity to speak as well. So Artrell, if you want to go ahead and unmute yourself.
Hi. I just had a question. Have we looked into like other major cities to see how they have their paratransit with their taxi service? I know I've been to other major cities and their taxis are equipped to take power chairs. So have we just looked into what those cities are doing to get their power chair accessibility?
Yes, we have. I've got I'm going to ask Fran Musi to comment on what we've done so far in terms of research and what information we have. I think we are in a unique situation that with our service. Fran?
So we are currently under a contract with American United. So when we learned a little more clearly earlier this year about the need for wheelchair accessible vehicles, we did reach out to American United. They are unable to provide them currently, again, in part because our program is based on metered taxi, and metered taxis are owned by independent taxi owners, much like an Uber or Lyft vehicle is owned by that operator. And so the program needs to get restructured so that someone like American United, who also has accessible vans in their fleet, could bid on that new program, or one of the van providers or some other company that has vans available. But so part of it is we're tied currently to American United through a contract, and they don't have the vehicles. And part of it is because of the structure of our program with the current fare structure. So yes, we've worked, there are several demand response programs all over the country. We've talked to other transit systems around the country about what they're doing and how. Part of it is cost. Those demand response trips often cost in the range of $90 to $100 a trip. And again, that becomes a budgetary issue. Typically they will charge a premium fare, or they might cap the number of trips that people take so that they can help try and keep those costs down a little bit. But again, it's not the fact that we can't get wheelchair accessible vehicles on the van, it's that, or on our taxi program, it's that we don't have them now, and we have to restructure our program so that we can make sure those are incorporated the next time around.
Gotcha. Okay, thanks.
You're welcome.
Looks like we have Shirley Robinson next. If you want to mute yourself.
Yeah, hi, can you hear me?
Yes.
Okay. I don't really use your service right now. My mom does. I'm in Atlanta, Georgia. She's in Milwaukee, Wisconsin, and I am her caregiver from here. Which is kind of hard to do. So there are times in which she does need to use the service. So what I did was I bought a whole bunch of ride fare tickets for her. It looks like I'm not going to be able to use those now, right?
No, you can still use those right now, Shirley. The tickets are good for the Transit Plus vans and the taxi program that at least runs through May of next year, if not further, depending on what happens with the county board.
And that's for the $4 each way, right?
That's for the $4 each way. On the taxi, that gets you the first $4, and then the rider's responsible for anything above $14.60 on the meter in cash.
Okay, so that starts right away, right now.
That's how it is now and has been for forever.
Okay, all
Mhm.
right, because they've never paid more than the $4. That's why I was wondering. Okay,
Yeah, I think you can go about 4 miles within the county before you exceed that $14.60 on the meter, which would require additional fare.
okay, thank you.
You're welcome.
Anyone else?
Hi, this is Don
Sorry.
Nancy.
My name is BJ Ermans. I apologize for joining late. I am with the Wauwatosa Commission for Persons with Disabilities. I am also a bilateral cochlear implant wearer, and both of my parents used Transit Plus extensively before they had to go to assisted living, for which we were very grateful. Since I did not hear the first part, I'm not sure if you would like me to share my thoughts on it, or if you just to listen.
No, please share your thoughts.
We found it to, even though we were only 1/2 block off a bus line, my father had dementia, and my mother had severe visual loss as well as hearing loss, plus chronic back problems. So they were not really capable of using the buses, and they found the taxis to be much more accessible. I was working full time, and they needed to go to Freighter quite a bit, and we don't live very far from there. So it was the taxi portion of Transit Plus was an absolute godsend. And I realize now there are other forms of transportation, but the cost also, even though we're not very far, I had to actually use that for a time, and that really added up. So part of it had to do with just the understanding of how the bus system would work, and was just why they were uncomfortable. Part of it was the mobility issues, and a grade of it had to do with the visual issues as well, in terms of seeing where they were and then not being able to hear on the bus, for example, where they were supposed to get off. So it made me more aware of how many people have multiple disabilities, and you put them together and it really makes the very user-friendly bus system that we have pretty much inaccessible for them.
Thank you. That the information that you shared is very helpful, and we are taking this information down to use as part of our process for making sure that we, as we're brainstorming and coming up with options, we're taking your thoughts into consideration.
I appreciate that. If you need any of us from the Commission for Persons with Disabilities with Wauwatosa, I am happy to put my contact information in the chat.
Yes, please do.
We are fortunate. We have representatives of a person who is blind, myself with hearing issues, mobility issues, and then and someone with multiple issues, plus parents with adult children with intellectual disabilities.
Okay. Thank you. Thank you
You're
very
welcome.
much.
You're very welcome. And thank you for doing this.
I believe the person with the 414961 number was beginning to speak. If
Yeah, it was Don Natsky.
Yep.
Thank you. Using old technology. My question
Could you repeat your name again, please?
Yeah, Don Natsky. My question goes to the what other options may have previously been considered in addressing this, prior to the decision to relinquish the taxi.
Prior to looking at the idea of moving to paratransit and eliminating the taxi service, at that time we were looking at just that, just the elimination. But having input from the community, getting that input and more details about and clarity about the existing service and what that might mean for future service, helped us to continue to look at what options might be available, and a willingness by the community to work with us, as well as our partners, the persons with disabilities, DHSS, and other groups, so that we might be able to explore options, present some ideas to the state, and see how we might be able to fund this moving forward.
Donna,
I'm not sure how transparent you are able to be at this point, but noting that the van contract RFP had been let previously and is presently under consideration, was there any possible thought to including a demand response component as part of what any new vendor might be proposing, or way to handle that, those kind of rides?
Fran, can you answer that? Because you're closely involved in that.
So unfortunately, I cannot speak directly to an open RFP at this point in time. I cannot speak to anything regarding that RFP. I can tell you, Don, though, that as I've mentioned previously, we did try and shift some of the contract the last time it was through to actually solicit alternative proposals for taxi, something that wasn't based on a meter. We were asking for proposers to give us a better option if they had a better option. It wasn't specifically written for wheelchair accessible vehicles at that time, but we were asking so that we could try and broaden our pool gradually of carriers or respondents to that same day ride RFP. The other thing that has happened is MCTS has done a study on demand response and what that could look like, what some options might be for demand response programs in Milwaukee County. So those things have happened prior to us getting to this point. But we are at the point now where the taxi contract ends at the end of May. The new van RFP doesn't start until November of next year. So there's a period there where we're in between, and and beyond then. So I can't speak directly to the RFP, but I do want to let you know that there have been other, we've been investigating what potential alternatives could be kind of all along. The bottom line goes back to cost of those potential alternatives as being prohibitive to the budget.
I'm not sure. Well, okay. So I think if I understand correctly, it was in not the present RFP, and I recognize you can't speak to it, but I'm not sure if I heard that in a previous letting of an RFP that that had been contemplated. Is that what did I hear that correctly?
In the last taxi RFP, excuse me, we changed some of the
prior, in the one prior to the van one that was previous to the present RFP. Did that contemplate having accessible vehicles, a la the taxi program involved in it? Is that what your reference was?
The previous van RFP was done in 2015, and that has accessible vehicles on it. It doesn't have a demand response piece built into it, but that's from 2015. So the RFP that's in process now is replacing the van RFP that was put in place, the contract that started back in 2015. It was an 8-year contract. The previous taxi RFP that went out in, 23 minus 3 is 2020. So it went out at the end of 2019 or early 2020 to start taxi service in June of 2020 is the RFP that I'm speaking of, where we asked proposers to give us some alternate if they had a suggestion for an alternate as opposed to being based on metered taxi. Did I clarify that?
I think so, but okay. So I guess where I'm going to, and I'm not sure if you're able to respond to this, but when the request for proposal was released, that is currently under review. At the time of the release, did it contemplate the possibility of demand response service being requested for comment in that RFP?
I can't speak directly to that RFP.
Okay, not the process subsequent, but the documents that were released at the time of requesting the RFP?
I mean, they're public record. There is not a demand response piece in that RFP. That's a public record, but
Okay.
there are always discussions before an RFP goes out on what that needs to look
Sure.
like.
All right, thank you. Looks like we have another hand raised by BJ.
Yes, thank you very much. One thing that I just recalled is something that our commission has been talking about quite a bit, and that is that any type of transit that is available for people who need it, especially if they have mobility issues, that at this time, all of it is to pick up people at street level. And some people, especially those who have temporary mobility conditions, have no way to get help down the steps from their house. We in Wauwatosa, and I know a lot in Milwaukee, have houses with steps. And I think it's a big problem. I have no idea how to address that, because I realize that is a huge risk issue as well as an expense issue in terms of having staff to help people down the steps. But it is also a very scary issue. And there are a lot of people who live alone. I myself have had one friend who was reduced to coming down the stairs from her house on her butt with a broken foot. I said, oh my gosh, this just is so a place for another accident to happen. And that's when I started asking around, and even services that say we pick up people with wheelchairs, they say, nope, it's all at street level. So I do not expect this group to come up with a solution to that. I just want to raise it to a wider audience and to your brain trust of people to consider that for the future. I would also mention that while I lived in Wauwatosa and my parents went to the geriatric doctors at Fredert transferred their geriatric services to their Menominee Falls Hospital. And I called and I said, you can't do that with the whole department, because that is outside of Milwaukee County. And we cannot use the Transit Plus to go there. And they said, well, so sorry, but that's what we did. So I realize that there are people who go to some of those different centers, and as hospitals and clinics are opening up to try and be closer to some people, they may be farther from others. So I don't know also for the future if some type of cross-county service, it might be feasible. And then I have a question for you. Does part of the funding for our transit system come from our share of tax revenue back from the state?
Yes, there
Okay.
is cost share as part of that. And so the effort that the county exec and the mayor of Milwaukee has been sharing with the public over the course of the last couple of months really does emphasize the need for Milwaukee County and the city of Milwaukee to get more of that cost share back.
Yes.
Help cover our services. And yes, it is part of the problem.
I thought so. And I just want to make clear too, I realize this is not something that you would be able to state, but as just a listener and contributor to all of the listeners out there, I would encourage you to find out if your state representative or senator approves of or supports the idea of revising the tax share formula, because Milwaukee County has sent in an additional $500 million in taxes since 2009. And yet our share of our tax donations, is how I think of it now, is still the same as it was in 2008. So if you are wondering why the transit system doesn't have funds to do some things, that is why the legislators will not revise that formula. And personally, I think we are due back payments with interest, which would, wow, give the transit system a great pile of money to work with. So thank you for, and the election is coming up, so vote. Thank you.
Thank you so much, BJ. I couldn't have said it better myself. Thank you so much.
I did
We
just
have
want to
an-
make, this is Fran, I did just want to make one other comment for the general public. You know, we are only talking here about the taxi service, Our van service is still available. It is a door-to-door service, and it is wheelchair accessible. And so if someone, the taxi program is curb to curb, the van system is door to door. We'll take you to any place within Milwaukee County, which is above and beyond what's required by the federal regulations of 3/4 of a mile around a bus route. So I just wanted to make that clear because I wanted to make sure there was no confusion. The van program is continuing to provide the service that it is designed to provide, and we'll get you anywhere in Milwaukee County for any reason that you would like to get there.
Thank you. Any more questions or statements?
I'm not seeing any additional hands raised, Donna.
Okay. I want to thank you, and I do want to make this clear, as I made it clear to members who participated at Friday's meeting, which was well attended. I appreciate your feedback, your comments, your questions, and definitely your concerns. This is something that MCTS and Milwaukee County will be working on. It doesn't stop with the budget process that ends in the next week and a half. We will continue to meet, get your feedback, brainstorm on how we will work together to make these options available and give you a chance to have input into how those are developed. I think given the uniqueness of many of the questions and concerns that have been raised here and last Friday, it has given us some good insight into how to have that conversation with our partners, persons with disabilities, DHSS, and ultimately as a united front, go to the state to see how they might be able to help us in this process also. So I don't see this as a done deal in terms of elimination. One, because the county board doesn't see it as that. They've already voted to extend it. And they're looking to us to come up with alternatives and ways that we might be able to bring new ideas to the table that might help us to deliver this service. So your participation and assistance is being asked for and requested. I'm not looking to have a 28 group membership for our strategy approach on this, but I do make the commitment to come back on a regular basis to make sure that you have input at each level of how we're getting to this process. I hope that that's a commitment that you feel confident that we will deliver on. I see a hand raised from Ms. Barbara Beckett.
Yes, thank you very much. This is Barbara Beckert with Disability Rights Wisconsin, and thank you, Director Brown Martin, for your commitment to getting public input and working with the disability community to continue to find a way to continue to provide this important service. And thanks to all the people who are here today. I just wanted to note that while the Finance Committee on the Milwaukee Board did approve an amendment to continue this service and to ask the county and MCTS to come back with a report as to how it can be provided in the future, that the full board has not yet voted on that amendment, and they are having a listening session tonight at the PAC, and people can attend in person and talk about how much the amendment is appreciated in the listening sessions, and that the disability community really wants to see this service continue, and talk about why it's so important. You just get 2 minutes, so you can't say that much, but I did include a link in the chat
to the county board website that has more information about that listening session. So I think it's always the most effective to hear from people who use the service. So if people are able to attend, that would be really powerful. So thanks everyone again for the opportunity to join you today and for this good dialogue.
Okay. Well, I know that we were scheduled till 1 o'clock, but as I said, I want to make sure that we give our ASL interpreters an opportunity to move on to their next meeting. And they really thank you so much for your help in coming and doing the interpretation for us on such short notice. I greatly appreciate it. We will be in touch with more information. I'll be working through Brian at Independence First and Miss Barbara Beckert, as well as through Fran, as we begin to set up additional discussion sessions and meetings. And yes, I will be scheduling some of these on Saturdays so that we can make it more convenient for you to participate. Thank you, everyone.